Hello, everyone, and welcome to KTAL News Now. I'm your host, Anthony Mocklin, and we are here with a very special guest who is here to talk with us about veterans and the conditions they face after they serve, and specifically those that are struggling with addiction and other conditions following their service. And here to talk with us today about treatments that are available to overcome this is Dr. Joseph R. Volpicelli, and he is the executive director of the Institute of Addiction Medicine. Thank you so much for being here today.
Thank you. Thank you for having me.
So, could you tell our viewers a little bit about what it is you do and how you're helping veterans?
Yeah, so I um, worked at the University of Penn for 25 years, where we conducted research to find effective treatments for addiction. And while I was there, I was also the chief of the alcohol treatment unit at the VA hospital. And what we found is that for many of our veterans, when they came back from combat exposure, they would suffer from disorders such as post traumatic stress disorder. And what we found in our research and in our clinical treatment was that combining good therapy to address the trauma, as well as medications such as naltrexone, we could successfully treat people. And so in my clinical practice, we offer these kinds of treatments to help individuals.
And one of those conditions specifically that was highlighted was alcohol dependence and uh, what can result from that. Could you speak a little bit more about what veterans are facing right now?
Yeah, so with so many veterans, as a way of coping with some of their distressing thoughts and feelings, will turn to using drugs such as opiates or alcohol, especially. And while the alcohol may temporarily help to numb some of these unpleasant feelings, over time, your body gets used to it and you get stuck in a terrible addictive cycle where you become addicted. And fully 10-15% of veterans who come to the VA hospital would suffer from alcohol use disorder. Fortunately, the VA is doing a much better job of identifying these people and offering effective treatments.
And one way to screen for risk factors when it comes to alcohol dependence, one of those risk factors is PTSD. Could you go into a bit of the process on like how to spot for that and what you can do about it?
Yeah, so for PTSD, it's important to look for people who suffer symptoms such as nightmares, intrusive thoughts. Sometimes they try to avoid situations that remind them of the traumatic event. They will often experience high anxiety, panic, or depression. And often they feel socially isolated. They don't want to interact with people very much. And what many people will turn to is things like alcohol as a way of helping to numb some of these unpleasant feelings. But the alcohol doesn't really work, not in the long term. And so people find themselves increasingly trapped in a cycle in which they're using the alcohol to calm the feelings, but it becomes less and less effective. And so at the VA hospital, they screen for emotional distress. And they also have good screening instruments to assess for excessive drinking so that now, as part of the electronic health record, primary care doctors are asked every year to screen for excessive drinking. And that's been successful in identifying more people who have problems.
And when it comes to treatment at these hospitals, there are medical assisted treatments with things such as Vivitrol. Can you talk a little bit about that and like for people who don't know what that is?
Yeah, so the frontline medicine to help people with alcohol use disorder, and I should say also people with PTSD and alcohol use disorder. I actually did a study where I looked at that. Is a medicine called naltrexone, which blocks opiate receptors. And there's various forms of naltrexone. You can take naltrexone as a pill, where you take it every day, or many people find that it's easier just to take it as a once a month injection. So extended release naltrexone or Vivitrol is available and paid for at the VA hospital.
And how else can it support recovery, I guess, long term? Like what does it exactly do to help with PTSD and any other condition?
Yeah, so for people who are using alcohol as a way of numbing their feelings, the alcohol no longer works. So the people don't experience any relief of symptoms. The naltrexone or Vivitrol helps to reduce craving, so it helps block that addictive cycle. And once that addictive cycle is blocked, then people can more effectively use psychosocial supports and therapy to help them recover from the PTSD.
And how important is it, not just for PTSD, but how important is it to treat each and every condition with the right tools and approach and just knowing, letting them know your understanding of them and that you're here to help?
Yeah, it's really important that we understand that for many people, they're encouraged to show bravery. They're encouraged to protect others, and they're not paying attention to protecting themselves. And so, one of the things we can do to help veterans on this Veterans Day is to help people understand that it's okay to ask for help. It takes courage to ask for help and to support them, not to judge them, not to make them feel bad that they have a problem, but to encourage them to get help. After all, they've worked so hard and served the services so well to help protect our freedoms. The least we can do is to help create an environment to help them enjoy the same freedoms that we experience.
And there are plenty of resources and information available at the U.S. Department of Veterans Affairs. Could you go into a little bit about what people can look out for and how they can get help?
Yeah, so probably the first place to start is by calling your local VA. And some of my patients will express a concern that they live far from the VA hospital and it's difficult to get there. But the VA has really been at the forefront of using telemedicine. So even if you're at some distance, even if you live in a rural area where there's not a local VA, you can still get help through telemedicine visits. And so that's a resource available. So try calling your local VA. There's also you can, if you have an emergency situation, you can call 988 and ask for help. And the government also provides a website to help find treatment near you. So it's called findtreatment.gov. And if you go to that site, you can find providers in your area that can offer help.
And I guess a little bit of a personal question, but what inspired you to want to help veterans in this way?
When I was a medical student at the University of Pennsylvania, one of my first rotations was at the VA hospital where I saw a veteran who had returned from Vietnam. And when he was in Vietnam, he was using opiates as a way of coping with all the stress. But when he came back to the United States, he turned to alcohol. And when I talked to him, some of my basic ideas about addiction and alcohol addiction were fundamentally changed by my experience with him. And I saw him as a person who was doing his best to try to turn his life around. And that inspired me then to go into the lab and to try to find more effective treatments. And we found a medicine called naltrexone, which blocks opiate receptors. And the very first study that we conducted was at the VA hospital in Philadelphia. And so I have a special affection in my heart for the VA, who's been really instrumental in helping to develop effective treatments.
That's awesome. And is there anything that I didn't ask you today that you wanted to touch a little bit more on?
Just to reinforce that there's help out there. So people who've been struggling, sometimes you can feel discouraged, feel helpless, that there's no help available, there's nothing you can do. Sometimes people feel guilty that why can't they control their drinking? But just to know that it's not a willpower issue, but it's a medical one. And there's effective medicines that can help reduce your craving, reduce that obsession that you have to drink, and then allows you to enjoy life or deal with other issues that you might have in your life.
Awesome. Well, thank you so much for taking the time to be here today.
But thank you.
And if you haven't yet, be sure to visit ktalnews.com, which is where you can find stories like this one, as well as other local breaking and trending topics. We stream every day, Monday through Friday at 1 p.m. on that website for KTAL News Now. But for now, I'm Anthony Mocklin. Have a great rest of your day, and thank you for joining us.